Hello, my name is Melissa and I will be performing an assessment on a 55-year-old male who came into the clinic. So first I'm going to sanitize my hand and I'm going to put on my gloves and I will wipe down my stethoscope using alcohol wipes. I will introduce myself to my patient. My name is Melissa and I will be doing an assessment. Can I confirm your name and date of birth, please?
St. Bernard, December 12, 2007.
Okay, Tyson. Today I'll be performing an assessment on you of your ears, your nose, your mouth, your neck, your upper extremities, your thorax, and your lungs. Could I touch you?
Yes.
So before we begin, I'm going to draw the grips for privacy. Are you comfortable?
Yes.
Do you want to use the washroom to empty your bladder before we begin?
No.
Okay, I'm going to ask you a couple of questions. I realized you had that sore throat for a couple of days. Did you take any medication for it?
No.
Do you have a history of thyroid?
No.
Do you have a family history of thyroid before?
No.
Is the sore throat worse than the first day it felt?
No.
You had no thyroid problems. Has a sore throat occurred in the past for you?
No.
Okay, thank you for your answers. So first, we're going to inspect your ears. So your ears is brown in color and there is no discharge. We're gonna palpate the ears area. You have any pain?
No.
Okay. Then we're going to go to the tragus area and we're going to palpate the tragus area. Do you have any pain?
No.
Okay. Now I'm going to whisper 3 words to your ears and you're gonna let me know if you hear me, okay? I love you. I love you. Okay. Then I'm going to have you I will use the otoscope now to inspect your tympanic membrane. So my patient is 55-year-old, so I'm going to pull the ears up and back. Turn your head a bit for me. The tympanic membrane is gray in color. There is no discharge. There is no swelling. Then we are going to inspect the nose. The nose is midline to the face. There is no discharge. Then we're going to check the patency of the nose by covering one side of the nose. And you're going to breathe out for me. And we're going to switch to the other one after and do the same way. So you want to begin by putting on one and breathe. Okay. Let's do the other side. Okay. Then I'm going to have you close your eyes. I'm going to pass something under your eye and you're going to let me know what it is, okay? Do you know what I pass under your nose?
Vicks.
Okay. So my patient's cranial nose is intact. Then we are going to inspect the patient's mouth by starting with the lips. Open your eyes. So the lips is pink in color. There is no lesions to the lips, no swelling. Then could you put your tongue out for me? Lift your head a bit. The tongue is midline. Then we're going to test the cranial nerve number 12 or your hypoglossal nerve. So you're going to stick out your tongue for me and make it go side to side. Okay, so that's good. And say light, light,
Light.
tight,
Tight.
dynamite.
Dynamite.
Okay. Patient has no tremors. Could you keep your mouth open? I'll be using the tongue depressor to look inside and around the tongue. Put your tongue up. Put your tongue up. Put it on. The tongue is pink in color. There is no lesions. Could you clench your teeth together for me? So the patient's gums is pink. There is no swelling or bleeding. His teeth is white. There is no looseness and no cavities. Then we're going to, could you open your mouth for me again? We're going to check for this hard and soft palate. So the hard and soft palate is pink in color, no lesions, and they are intact. Then we are going to look at the uvula. Flip your tongue. So the uvula is midline. Then we're going to test cranial nerve number 9, glossopharyngeal. Put your tongue down. And you're going to say ah for me. Ah, ah, okay. So the soft palate rises when the patient says ah. Cranial nerve number 10 is intact because he's able to talk to me without hoarseness and he's able to swallow. Then we have we're gonna extend your head up. Put your tongue inside. Put your tongue inside. So we're gonna check his trachea. The trachea is midline. There is no obvious enlargement of the thyroid. No visible masses. No tenderness. Are you in pain? No. Okay. His head is aligned with his spine. There is no scars and no lesions. Then we will test cranial nerve number 11 or the spinal accessory by moving your head side to side, up and down. And you're going to push. Okay. Okay. Cranial nerve number 11 is intact. Now we're going to palpate the carotid artery. I'm going to palpate one at a time. So both sides of the carotid artery is 2+ and equal. Rhythm is strong. Then we're going to inspect the upper extremities. His upper extremities, he has no scars, no lesions, no involuntary movement, no swelling or edema, no muscular atrophy. Then we're going to palpate the skin. His skin is warm to touch. There is no edema, no swelling, no masses on the skin. Do you have any pain? No. Okay. So he has no tenderness or pain. Then we're going to check the nails for his capillary refill. Put it in your hand. Capillary refill is less than 2 seconds. There are no lesions. His nails is white. Then we are going to check the range of motion in your fingers. So you're going to flexion and extension of your fingers. Then your elbows, you're going to rotate for me. And your shoulders. Now we're going to inspect the patient's thorax. There are no scars, lesions, or skeletal deformities. Respiratory rhythm is regular. No respiratory distress. There are no lesions. Are you in any pain? No. So he has no tenderness, no pain. It's warm to touch. His chest is symmetrical. I'm going to auscultate now. I'm going to auscultate the bronchial. The bronchial sound is very hard and tubular. Then we're going to auscultate the bronchiovascular. Bronchiovascular has medium sounds and is less pitched than bronchiovascular, and the inspiration is equal as the expiration. Then we're going to go for the vascular breath sounds. It's a little low pitched. Expiration is a little weaker than expiration. His lobes are all good and equal.